Welcome to the RX Physiotherapy Podcast, your go-to destination for all things physio, rehab, health, and wellness. I'm Patterson.
And Trent.
And each week, we will dive deep into fascinating topics within the health world, from physiotherapy to nutrition and beyond. We cover it all. So sit back, relax, and enjoy the journey as we explore the exciting world of health and wellness. Let's get started. Hi everyone, and welcome to another episode of RX Physiotherapy Podcast. Today we have Trent with us. He is a physiotherapist with a special interest in golf, and he has lived experience with golfing at quite a high level. Trent is so passionate about what he does and golf in particular, so I'm very excited to learn a little bit more about it today. I'll get you just to give us a little bit of an intro, Trent, about yourself.
Thank you, April. Can't probably beat that intro there. That's a pretty good one. So obviously grew up in around the Illawarra area. Started playing golf at a very young age, around 3 years old. Started out at Russellvale and then worked my way through high school and got an offer to go over to the States and play college level golf. Was over there for 4 years and like probably a lot of golfers, picked up a couple injuries that shifted the focus into understanding why I'm getting injured and led me down the path of physiotherapy and came home and did my master's at the University of Sydney and kind of found then the little niche of trying to go down the golf physio route.
Awesome. All right, I guess let's start off with what exactly is golfing physiotherapy. Like, what's that include? It's like a big picture.
So golf physiotherapy is a kind of like little sub-branch of physiotherapy. It focuses on mainly kind of prevention, treatment, and management of injuries related to golf. It also involves kind of optimizing golfers' physical capabilities to improve performance, including like strength, flexibility, mobility, and balance tailored to the kind of golfer's specific swing, basically.
And why do you think it's important to see a physiotherapist as a golfer, especially amateurs? Ever since COVID, there's been such an influx in golfing as a sport. Why do you think it's necessary to get that professional opinion? Especially as an amateur.
Well, if we think about how the very elite level pro golfers, they have a team of experts that deal with them daily. So whilst most amateur golfers don't really have that access and luxury per se, so often you find amateur golfers overlook the physical conditioning side of things. Golf involves complex repetitive movement. It's quite unnatural for the body because we're built to run, jump, throw. So without the proper body mechanics or the flexibility, players are at risk of injury. So physio helps to kind of reduce if they do have pain, but improve movement form and kind of just extend like amateur golfers' playing careers.
Yeah, that makes a lot of sense. From my very limited experience with golfing, I can see how learning how to do things properly would prevent me from being injured, 100%. Can you take us through the most common injuries you see in golf? Like a little bit of what people can look out for.
Probably the most common ones I'll probably most likely see and have seen in the past is lower back pain, generally due to rotational stress, golfer's elbow, wrist and shoulder injuries, and like neck stiffness. Like usually these stem from like kind of poor swing mechanics or like physical limitations, like tight hips or like weak core muscles.
That makes a lot of sense. And because you're doing so much in terms of like force translation, and like you said too, it's such an unnatural movement for the body, you can just imagine that these structures are just absorbing the force instead of being able to translate it properly, which means you're also probably losing force on the ball as well too, and your body is absorbing it instead. So that makes a lot of sense. Is there a specific part of the body that golfers like tend to neglect that you think is like quite a leverage point for most people?
Yes, definitely. I'm also guilty of these, especially prior to me going to the States. Like areas kind of around like the thoracic spine, hip mobility especially, like core stability is a big one. Then usually find they're generally undertrained. Many golfers focus on like arms or technique without addressing like kind of the physical foundations that are needed to develop an efficient and injury-free swing, basically.
Yeah, that makes sense. And given this, what would you say is important to go through in order to prevent injury and increase performance as well? So, what does a physiotherapist do to help prevent these injuries in golfers?
So generally, I'll go through a physical assessment to start with, kind of looking at mobility, strength, posture. Then kind of from that, we'll kind of identify movement dysfunctions, and then go into creating personalized exercise programs, mobility programs, and educating kind of golfers on warm-ups, cool-downs, and swing safe practices. So like stuff to do in the gym and all that.
Yeah, no, that makes sense. So, yeah, what would you say the role of mobility and flexibility is in a good golf swing in general?
It's a massive role. Restricted thoracic spine or tight hips can limit rotation and power. Flexibility allows a full range of motion, while mobility helps with the body move efficiently and in coordination, both essential for swing consistency and power.
Yeah, that makes sense. If you don't have the range of motion, then you just can't generate that force within it. And I imagine then you're having to use a lot more of your muscles as well too to generate it. Like you're trying to fight your own stiffness to go through range. So yeah, that makes a lot of sense. So in terms of the strength training, and that's something that we're massive in with RX Physiotherapy and having the full gym as well too. How does strengthening the body help with golf? Because I'm sure a lot of people are thinking, if I just play more golf, I'll just be better at golf. Whereas it's not always the case, and I think it would be great for people to understand that.
So strengthening kind of like your bigger, more powerful muscles like your core, your glutes, and especially around your shoulders can lead to like a more powerful swing, better control, less fatigue whilst you're playing, reduced injury risk as well. It's not about bulking up, it's about functional strength, and that's the main key to it.
That makes sense. So it's almost like it makes your body like more efficient. So you have to work less hard to have the same output. No, that makes sense. So I know that you are TPI qualified, and I'd love for you to talk through what that assessment process looks like and why it's so valuable for amateurs to pro golfers in general.
So being TPI certified, I'm able to kind of take golfers through different screenings, and it kind of unlocks my ability to be able to pick little swing characteristics up. But I'll start kind of explaining what the TPI is. It's the Titleist Performance Institute. They're the world leading authority in the body swing connection. It's a system that's used by top professional golfers, coaches, and like medical experts to how to assess golfers' physical limitations that affect their swing mechanics. TPI screen, it's a movement assessment that identifies physical limitations affecting golfers' swings. It includes tests for mobility, stability, balance, and coordination. Based on the results, it will basically predict swing characteristics like early extension or sway, and build a custom rehab or performance plan to improve both movement and mechanics. And basically, the TPI's philosophy is pretty simple. There's no one way of swinging a golf club, but there's one efficient way for every golfer to swing, and it's based on what like everybody's body is able to do, basically.
Yeah, that makes sense. So if you're someone who's like, it depends on like how tall you are and how long your arms are, and I get what you're saying with that because there's not one swing in the same way that we don't have the exact same measurements in our levers. So that makes a lot of sense. And then in terms of making it towards that person individually, give an example of like your swing analysis as part of the physiotherapy approach.
Yeah, so because I am TPI certified, I can look at a video of a player's swing, and then basically watching that swing, and then from their physical screening, I'm able to identify any particular swing characteristics that may be harmful to their body or reducing their ability to be able to generate power. There's 15 big kind of characteristics that I can say for a later date. But there's 15 main ones that a lot of golfers generally seem to have, and there's usually kind of exercises and different ways to kind of address it, which is handy.
Makes sense. And how long does it usually take typically to see results? Is it a couple of sessions, or are they looking towards those like few months? In your experience, what do you usually see in terms of expectations?
So it kind of varies. So if someone's coming in to see me for an injury specific type thing, usually we get like kind of pain relief in the first kind of 2 or 3 sessions, especially for acute pain. While kind of performance improvements can take anywhere from like 6 to 12 weeks to start seeing those results happen. Because there's no magic pill to say, yep, take this and you're going to hit it 50 meters longer, just be able to be pain free tomorrow. That's just not how the body works. But long-term results come from like ongoing maintenance, basically.
Yeah, no, that makes sense. And golf, it's just my opinion, has got to be one of the harder sports in general to get good at. So most golfers are quite patient by nature, I imagine. Or doing it to learn patience. Oh, what are 3 exercises that every golfer should be doing regularly?
So my big 3 that I like to give most golfers, kind of pelvic tilts and bridges. They kind of target core and glute activation. Thoracic spine rotations, especially for that rotational aspect and mobility. And then the good old hip 90-90 stretch for good internal and external hip mobility, again for that kind of lower body rotation aspect as well.
That makes a lot of sense. What you said earlier about the restrictions that golfers get. And what's a good warm-up that a golfer should go through in order to make sure that all of their muscles are ready to translate force and move within ranges the body usually doesn't these days?
So a very simple 5-10 minute warm up that like almost all golfers should incorporate before they play. Just simple arm circles, torso rotations, hip openers, and just kind of gentle practice swings. Those essentially 4 movements basically prime the body for the specific movement of the golf swing and reduces overall risk of injury by quite a fair bit.
No, that makes a lot of sense. And how often should a golfer see a physio to like be at their best, whether they're injured or whether they're just wanting to perform at their best?
So for like say injury wise, like initially trying to get in a couple times a week, and then we can kind of tailor it to maybe once a week, then lead down the track of a couple times a month, that type of thing. But for the most part, for kind of performance-based stuff, assessments, check-ins every 6 to 8 weeks. If you're really trying to achieve high-level golf, obviously more frequent than for injury stuff, and generally a screening every 3 to 6 months as well to kind of keep up on top of any kind of faults that may be kind of causing any swing issues or mechanical issues or pain, basically.
Yeah, no, that makes a lot of sense. That all makes a lot of sense in terms of if you're injured, then you're going to need to be seen more frequently at the start so that we can get your pain levels down. We stop the muscle inhibition so then you can get the muscles working. And we know the body thinks about how to survive right now versus if I move ineffectively for 20 years, what's going to happen to me. So that makes a lot of sense. Yeah, no, thank you so much for your insights on golfing physiotherapy. I think it's an area that is growing, and you're very right in terms of the movements that are required are not something that we do day to day. So you are quite vulnerable in any movement that you're not doing frequently. And even if you're not injured, that you can learn how to move more effectively as well. So for those golfers out there that are frustrated and they just feel like they've hit a sticking point and they're just not getting any better, and they might not be in pain, but there might be some very little things that you're just needing a bit of support and analysis around, and Trent can help you with that. So yeah, you are an asset to the Illawarra. Oh no, I've been cringe again. Oh well, you're all used to it. Oh well, thank you so much, and we will see you all in the next episode. And thank you so much, Trent.
No, thanks for having me on.
Bye.